Kia ora team, my name's Ben, and how do we perform a blood sweep? So a blood sweep comes in our primary survey under C for circulation. So first thing we want to do is if we have a suspicion of bleeding that we can't see, we need to get consent if they're conscious. Kia ora, my name's Ben from the ambulance. You had a nasty injury and I just want to check that there's no bleeding that we can't see. So this is going to involve me running my hands around the back of your head and the back of your body just to check for any blood. Is that okay? Consent, tick. If a patient is unconscious, then we're going to act in their best interest. Okay, so running my hands around the back of the head, check. Back of the shoulders, check. Behind the arm, behind the other arm. Getting in behind. And then tucking behind the back. Coming in as far as we can get, checking, okay, running down the leg, and the other leg. Okay, and we're clear. So it should be fast, looking for any significant bleeding. All right, happy studying. But wait, there's more. What if we do find blood? So, checking behind the arm. Okay, I found blood on my glove. Talk to the patient. I found blood on my glove. So do you mind if I just expose your arm to check the bleed? Yes, great. Either, hopefully, we can just slide the clothing up, or we may have to cut it off to expose the bleed. Then we're going to assess whether or not this bleed is significant enough to address now, or we're just going to note it and address it later in our survey. Once we've done that, we can protect the person's modesty, change our gloves, and continue with our blood sweep. Okay, and we're done. Happy studying, team.
Yeah, down. So a tip for your OSCE, in your OSCE you probably have a mannequin, but always pretend like it's an actual human being. So things to avoid is if it was a person, you'd make sure you'd always get consent before you touch them. So you don't just rush up to someone and start blood sweeping. So that's not appropriate. The other thing is, it's disrespectful and relax. And we never want to step over our patient when we're doing and performing our objectives. And always be mindful of where your body position is as you're doing your blood sweep. For example, palpating the back of the head, and then we wouldn't go straight from here to do the chest. So things like this, it's important to be aware of. All right, team, happy studying.